Otherwise, the concept behind that is this one. You got this? Most important concept. Block 3, it will be tested. And of course, in other exams. Coming to the next one. Pyruvate metabolism. I have, my title for this particular slide is Pyruvate metabolism. That means what are the different ways that pyruvate can go? So far, we have seen 3 ways where pyruvate can go. We have studied 3 ways so far. What are the 3 ways that we have studied? What is the first way that we have studied where pyruvate can go? Towards lactate, anaerobic glycolysis. Pyruvate goes to lactate. What is the purpose of pyruvate going into lactate? I told you, you should remember it's important. What is the only purpose of pyruvate going into lactate but done by lactate dehydrogenase? What is the purpose of lactate dehydrogenase under anaerobic situations? To regenerate NAD plus, to oxidize NADH into NAD plus, regenerate NAD plus. That's the only purpose. You got to remember. Okay. So lactate is made. What is the other fate of lactate? Sorry, pyruvate. Pyruvate go into mitochondria and go into acetyl-CoA. Pyruvate dehydrogenase complex. We have studied that. And then today we have studied pyruvate can go into oxaloacetate by pyruvate carboxylase. Okay. And later in third block, we are going to study pyruvate can go into, not third block, even in block 2, gluconeogenesis, I will explain you. Pyruvate can go into alanine formation. Alanine, amino acid alanine. It can be made from pyruvate by a process called transamination reaction. Okay. So these are 4 ways that pyruvate can go, and you need to know all 4 of them. Pyruvate coming from glucose, going into lactate, that is anaerobic glycolysis, to regenerate NAD plus, co-recycle, and then pyruvate going into acetyl-CoA by pyruvate dehydrogenase complex. We have studied that. Pyruvate going into oxaloacetate by pyruvate carboxylase. PC here is pyruvate carboxylase, acetyl-CoA, biotin, and all that we have seen. And pyruvate going into alanine formation by alanine transaminase. ALT is alanine transaminase. And one of the, which is the coenzyme for transamination reaction? Vitamin coenzyme for transaminases. You have studied that. Vitamin B6. Remember B6, transamination, allosynthase, cystathionine beta synthase. All there are names of enzymes for that. So, vitamin B6. Okay. Now, why I am showing this to you is there are certain concepts which are connected. What we will do now is we are going to decrease pyruvate carboxylase enzyme. Let's consider your pyruvate carboxylase enzyme is not working. Let's say it is mutated and not working. Pyruvate carboxylase enzyme deficiency. Pyruvate carboxylase enzyme is deficient or biotin is deficient. Either way, because biotin is the coenzyme for pyruvate carboxylase. Either enzyme is deficient because mutation or biotin deficiency, vitamin B7 deficiency. During that time, what will happen? What is the option for pyruvate? Pyruvate is not going down into oxaloacetate, right? Because your enzyme is down, pyruvate carboxylase enzyme is decreased. So, conversion of pyruvate into oxaloacetate is down. So, what is the option for pyruvate now? Where this pyruvate can go? What are the options for pyruvate now? Pyruvate go into acetyl-CoA. It can go into acetyl-CoA. And then it can go into lactate. It can go into alanine. My question is, because now pyruvate has 3 options to go. Can go into acetyl-CoA, lactate, alanine. My question is, out of these 3, that is lactate, acetyl-CoA, and alanine, which will build up in an abnormal way? Which are the molecules that will build up in an abnormal way and appear in the blood? It is alanine will appear and lactate will appear, but not acetyl-CoA. I want you to know why. So, when pyruvate is diverted into acetyl-CoA, so initially this acetyl-CoA may build up, but what is the effect of acetyl-CoA on PDC? What is the effect of increased acetyl-CoA on PDC? Negative inhibitory, right? So this will have a negative effect on PDC. And also this NADH, which is initially building up, it will have a negative effect on PDC. That means overall diversion of pyruvate into acetyl-CoA slows down because it has a negative effect. That is why you don't see accumulation or buildup of acetyl-CoA because it has got a negative effect, feedback negative effect. It doesn't allow diversion of more and more pyruvate into acetyl-CoA. You don't see acetyl-CoA appearing in the blood, building up. You don't see that because there is a negative effect. But what can happen is it can go into lactate. So there will be buildup of lactate. It can go into alanine. So such negative feedback effect is not there on these two sides. Can go into lactate, it can go into alanine. That is why in pyruvate carboxylase deficiency, patient will show lactic acidosis and hyperalaninemia. See, number 1 I have written here. Causes for lactic acidosis and hyperalaninemia. The first cause that I have written is decreased pyruvate carboxylase activity or biotin deficiency. Most important. You will realize this when you see the case stem, doing practice or maybe in the exam, how important it is. Always remember, if you look at the case stem, and if you are seeing lactic acidosis along with alanine level building up, hyperalaninemia, it is called hyperalaninemia. Increase in lactate, increase in alanine in the blood. You have two options to go for. Look for both the enzymes if it is there in the choice. Either one will be there. One is pyruvate carboxylase or associated with like biotin deficiency, either way. The second one, okay. So with that, I'll stop it here. Now, I'll take you to the other direction. What if your pyruvate dehydrogenase complex is mutated? PDC mutation, either E1 subunit mutated, E2, E3, whatever, mutated, not working. What will happen to the pyruvate now? Pyruvate again goes like kind of building up. So what happens to acetyl-CoA? Acetyl-CoA decreases because pyruvate dehydrogenase deficiency is there. Acetyl-CoA is down. If acetyl-CoA is down, in which direction your pyruvate will go? Now one option is out. You cannot take it to acetyl-CoA. What are the other options for pyruvate? It can go into alanine, okay. Then it can go into lactate, okay. Does it go to oxaloacetate? Excellent. That's what I wanted. Always remember, pyruvate to oxaloacetate by pyruvate carboxylase. What is the activator? Acetyl-CoA, which is an obligate activator. Don't forget that. Obligate activator. Without that, you cannot take it. That is why, because acetyl-CoA is down, that's why even conversion of pyruvate into oxaloacetate is also down. Because this obligate activator, that is acetyl-CoA having an obligate activation, it is not there. So that's why oxaloacetate is not a product of pyruvate when pyruvate dehydrogenase complex is down. So that means you are left with only two. There will be buildup of lactate, buildup of alanine. So that is why I written down here second cause for lactic acidosis and hyperalaninemia is decreased pyruvate dehydrogenase activity, coenzyme deficiency, or arsenate toxicity. Whatever affects pyruvate dehydrogenase complex, that will lead to lactic acidosis, hyperalaninemia. Can be PDC deficiency itself, or it can be any coenzymes that are deficient, needed for PDC, or arsenate toxicity. Is it not? Arsenate, E2, blocked. You got the idea? See, Lot of questions can be made on this figure. This figure is from UWorld. So make sure you remember the star mark, highlight, important. All of you got this? Okay. So that's all for pyruvate metabolism. Let's see if I have a question. Yes, there is a question here. So this patient is showing severe lactic acidosis and elevated blood alanine level. So this is a case of lactic acidosis along with hyperalaninemia. So whenever you see lactic acidosis and hyperalaninemia, two enzymes should come to your mind. One is pyruvate carboxylase deficiency. Second is pyruvate dehydrogenase enzyme deficiency. So either one will make answer. In this choice, there is only one available because you are allowed to choose only one choice, right? So you got to go for pyruvate dehydrogenase complex as your choice. Complex not written, but pyruvate dehydrogenase. Okay. So now the question is, in the case stem, when you look at the case stem, and then you have found out that there is a lactic acidosis and hyperalaninemia, and then later in the choices, you have seen both the enzymes are given in the choice. Pyruvate carboxylase is provided in the choice. Pyruvate dehydrogenase is also there. Then how do you differentiate between pyruvate carboxylase and pyruvate dehydrogenase? How do you go for one correct answer when both of them are given? At that time, what you need to do is look for additional information in the choice. Sorry, in the case stem. The additional information can be if you find a biotin deficiency directly or indirectly, if the person is consuming raw egg whites frequently, or if the person is on anticonvulsants or antibiotics for a prolonged period of time, is it not? That person may go into biotin deficiency. And the signs and symptoms along with this hyperalaninemia and lactic acidosis, that patient may show dermatitis, diarrhea, neurological issues, frequent infections. They all will give you clue to go into biotin deficiency, and your choice will be pyruvate carboxylase rather than pyruvate dehydrogenase. Okay, right? How do you go towards pyruvate dehydrogenase then? So in pyruvate dehydrogenase, if your answer is towards pyruvate dehydrogenase, look for is there any arsenate toxicity in this patient, like garlic odor, or the train drop pigmentation, meese lines on the nails, hyperkeratosis on palms and soles. If that is what is there along with lactic acidosis and hyperalaninemia, then your answer will be pyruvate dehydrogenase, not pyruvate carboxylase. Or if there is any other vitamin deficiency like thiamine deficiency, riboflavin, niacin, pantothenate, they all required for pyruvate dehydrogenase, not pyruvate carboxylase. So your direction is to go into pyruvate dehydrogenase. You're getting this? This is how you will differentiate if both the choices are there in both the enzymes are there in the choice. If only one enzyme is there, you don't have any confusion. You go for whatever is available, that one enzyme. Okay. So this is how you will be answering questions.